Thank you. So we're in the middle of talking about nutrition and pregnancy. We ended our last lecture talking about vitamin A. And remember, what we do is for each stage of the life cycle, we pick out nutrients that are of particular importance for that life stage. We don't talk about every single nutrient. So we've hit several nutrients with respect to pregnancy, and these are the last few. We'll discuss these today. So the last one was vitamin A. And I want to remind you that that is actually something that should not be consumed in supplemental form for pregnancy because it can cause birth defects. Remember the name teratogen, which is something that causes a birth defect. So vitamin A in high doses can be a problem. Beta carotene's okay, it can turn you orange, but it doesn't cause birth defects. But vitamin A, preformed vitamin A in form of retinol can. Okay, so then the next nutrient is vitamin D. And vitamin D is important, and it's interesting because it's gotten a lot of press lately over the past few years. I've been studying nutrition a long time, and nutrients become popular for a while and then kind of fade in popularity. You know, we're hoping, oh, a supplement of this will change the world, and then we realize, well, it doesn't really do that. And that's pretty much the story of nutrition, is we need an adequate amount of nutrients, but extra nutrients taken in pharmacological doses, such as way more than you would get from diet, generally aren't good for you and don't help. We need enough, right? But with vitamin D, it's not always easy to get enough. So let's talk about a little bit about what vitamin D does, and then talk about what the issues are. So the function, then there are many functions, but for pregnancy, it's to help with bone and tooth formation and also immune function. So vitamin D is critical for development. And you can think about skeletal development because of calcium and phosphorus and how much bone is going to be accumulated during pregnancy. And this is why it matters, because deficiency is pretty widespread. So if maternal deficiency occurs, then the infant is going to be facing that vitamin D deficiency too. Remember that vitamin D is one of the nutrients that infants need to start taking pretty much after birth, right, up and for the first year of life. So why does it matter? Well, if mom is vitamin D deficient, then the infant is at risk for rickets, low birth weight, problem with bone development. And mom herself is at risk for osteomalacia, means low bone density, cardiovascular disease, and preeclampsia, which we're going to also talk about today. This is a condition that is life-threatening in pregnancy. So what about foods? There are good sources, and I'm trying to see let's see. There are good sources of vitamin D, but you have to be going after them. They're not all over the place in your diet, and it's very easy if you're not drinking fortified milk. It's very easy to not get very much vitamin D in diet at all. You can see the requirement is in IU, and these numbers are in IU here, which is international units. So requirement 600 IU, and it doesn't change for prior to pregnancy, or lactation. It's the same amount, but you can see that if we're looking for 600, 41's not a lot. Salmon is a lot. Tuna is a lot. So these fishes are good sources. People don't take cod liver oil anymore because besides having vitamin D, it also has high levels of vitamin A. So it's not recommended. But I wanted to show you that fish liver can have a lot of vitamin D. And then we have fortified foods. So look how few natural sources there are. This is not something, in fact, vitamin D isn't really a nutrient. If you live in an area where there's adequate sunlight exposure, in theory, you can make enough vitamin D from exposure of the skin to the sun to create your own vitamin D. But we all don't live in those types of conditions, and we also live in indoor lives. And we also stay inside in the winter. So I'll talk about that a little bit more. So it's hard for us to get enough vitamin D. And so we add it to milk. This is probably one of the first things you learned about in food science and in intro nutrition, is that milk is fortified with A and D. And some cereals will provide it. So sometimes there's fortification, but it's not easy to get. So what issues do affect the status? That low intake, so vegan diet, you're leaving out the fish and the dairy, you can see you wouldn't be getting, and eggs, you'd be getting no vitamin D. And obesity increases the risk because apparently what we do is we sequester vitamin D in body fat. So if you take a blood sample to see how much circulating vitamin D there is, there's not very much. So it seems to be sequestered so that people can take supplements and their levels, it's hard to get their levels to go up. And the other issue, which I expect you remember as well, is that limited sun exposure. And this can be due to a variety of reasons, use of sunscreen, heavier skin pigmentation, location. So location is shown here. In vitamin D synthesis, you can see the yellow to red is likely, the green not so much, but we're certainly in the likely range in Texas here. And then you look in the winter and that's not the case anymore. The angle of the sun is such that our skin doesn't make adequate amounts of vitamin D. So these are all the time, a little picture of all the things that can affect vitamin D status. So what are recommendations? We already showed the slide earlier that had 600 IU per day. The American College of Obstetricians and Gynecologists actually recommend pretty high dose supplements. Now, this is a pretty large amount, but it seems to be safe. And remember, when we talked about breastfeeding, how mom can consume as much as 6,400 IU per day to provide enough vitamin D in her milk. So there's some latitude on taking high doses. Having said that, I would never take more than is recommended by American College of Obstetricians and Gynecologists. This is not something we should self-medicate with. And supplements come in different forms. You may or may not remember this. There's a slight difference in structure, vitamin D and D3 and D2. D3, if you're going to take a supplement, get one with D3 in it, and I recommend that to people. And here's a generic statement that's not always true. 15 minutes, this is in the sun with light pigmented skin. 15 minutes 2 times a week generates a lot of vitamin D. All right, so we have the capacity to do that, but we often don't do it for the reasons already mentioned. Think about high risk too. Say you're an African-American female and you live in Chicago. All right, you've got several strikes against you. It's cold, you're not gonna have your skin exposed, skin pigmentation is gonna interfere with vitamin D, synthesis by the skin. And so vegan on top of that would be very dangerous. So supplements are important in those particular cases. Okay. Calcium, these go hand in hand. Calcium is required for many things, not just teeth and bones, although I think elementary school kids know this, but it's important for muscle and nerve function and blood clotting and so on. So it's a critical nutrient. Notice here, please write this down, make a note of it. Notice that here's the ages 14 to 18, and here's over 19. And notice that the calcium requirement is the same for pregnancy, not pregnant, pregnant, and lactation. And calcium for over 19, same thing. It doesn't change. All right. Now, the reason it doesn't change is because the body becomes better adapted to absorbing the calcium that's consumed. So instead, she needs more, but she absorbs more in the gut. Okay, so it doesn't increase during pregnancy because absorption increases. If calcium intake is low, here's the risk, and we'll talk about all 3 of these in the last lecture. She is an increased risk for pregnancy-induced hypertension, and that can be dangerous. Her blood pressure goes up. One form of that, which we'll have a couple of slides on, called preeclampsia, is a form of hypertension that can elevate her risk for having seizures and dying. So this is a condition that's very scary. And then also, if she has exposure to lead poisoning, if her intake of calcium is low, her risk for that exposure is greater. If you remember your chemistry, these are divalent cations, meaning they have a +2 charge. So calcium has a +2 charge, lead has a +2 charge. And so lead is not a nutrient, it's a poison, but they can be absorbed in the same way. So if you consume enough calcium, that can help interfere with absorption of lead, even if exposure occurs. So here's some food sources. As you can see, we always have milk on the list, right? And this is milk and dairy products are pretty good. So this is why dietitians often recommend to go ahead and have your 2 or 3 cups of milk a day, because it helps get vitamin D and it helps provide calcium. Now, the difference is we did talk about vitamin D, and not all yogurt is fortified with vitamin D. Yogurt naturally has the calcium in it, but you would want to look at the label to see if it has vitamin D as well. Milk does. In the United States, milk is going to have both vitamin D and naturally occurring calcium in it. All right, so, but notice, so it's easy to talk about dairy, but look at these other sources: tofu, sardines, cooked kale, fortified cereals, cottage cheese. Doesn't have as much, but it's still got some, and then some vegetables. So a well-rounded diet, including almonds and things like that, can help provide a nice calcium status. Okay, there are, I can't see my own slide here. At the bottom, what just came up is this: if you want to take a supplement, these are the most bioavailable, so calcium carbonate and calcium citrate. And sometimes calcium citrate is added to orange juice, right? So that's one way that you can get a fortified product. We good so far? Any questions on vitamin D and calcium? Nothing in the chat? Okay. So the next nutrient is zinc. And I don't have a lot to say about zinc because it's not well understood. However, that doesn't mean it's not important. We know that zinc is functions is there are over 200 enzymes that actually require zinc for function. So zinc is absolutely critical for growth. If you may remember from your introductory classes that boys, and the typical example we talk about in those classes is boys around the age of 10, if they're zinc deficient, they'll stop gaining height. Okay, they'll grow to full adulthood at the size they were when they were 10, and they also don't develop sexually. So zinc is required for the overall growth of the body and the development. Now, where do you get it? The high bioavailability from meats, just like iron, and also if individuals, so this is the good sources, but this should say the risk here. Vegetarian diet, if someone's eating a vegetarian diet, then they're not getting meat. If they're also taking iron supplements, that may interfere with zinc absorption. And if they're not taking in zinc, then they have a risk for low intake. So being a vegetarian, taking iron supplements, and not eating good food sources of zinc. This makes it sound like we must consume meat. That's not the case. We can get zinc from beans and other foods. It's just not as readily available. This is why my primary recommendation for people is a diet that's primary vegetarian with pieces of fish in it and so small amounts of animal protein for ideal nutrition. So what happens if there's low intake? We're not really clear about it, but it's of concern. And the reason that we're not as clear about it as we are with iron is because it's so easy to measure iron status, right? We've got hemoglobin and hematocrit and proteins in the blood that carry iron. So we have a way to assess iron nutrition. But with zinc, there's no really good way to do that. So it's hard to tell if a woman has good zinc status or not, because you can't take a blood sample or a skin sample or something like that and look for zinc status. So we know it's important. We know what happens when severe deficiency occurs, such as preterm delivery and infections, but we don't have an exact set of symptoms if someone doesn't consume enough. We just know it's important to get. All right, sodium may be a little surprising for you. Okay, so grams per day. The requirement is 1.5. If you recall, most Americans eat 3 or 4 times that. And the upper limit is 2.3 grams per day, or 2,300 micrograms. Now, the thing about sodium, we spend all of our time talking about restricting sodium because it's increased risk for hypertension And there are issues with that with adults, but in general, everybody's a bit hands off about sodium and pregnancy in terms of not restricting. People used to restrict sodium and that would interfere with growth of the fetus. So we don't want to do that. We just want to basically, salt to taste. Sorry, that just went away, but yeah, salt to taste. Now, the problem with the American fast food diet is you don't need 7 grams of sodium per day, right? So cooking real food would provide a reasonable amount of sodium per day. So I'm going to do a new screen sharing. Are there any questions about that while I get ready for the next one? Okay. Y'all see this okay? Somebody say yes. Kristen, I can see you. Can you see it? All right, thank you. I don't see most of you when I'm lecturing. All right, so this is the last lecture on pregnancy. We will have one more small section on WIC, but we'll talk about that later. But this is part 3, and this has to do with pregnancy concerns. And so here's your outline. We'll first talk about maternal mortality and critical periods of development, which will help you understand a lot about development. Maternal conditions that mom is at risk for, and then also food safety. So we begin with maternal mortality, and the definition is deaths per 100,000 births related to pregnancy within a year of birth. So some people die during childbirth. I'm sorry, there should be another 0 there. Some people die during childbirth. Some people don't die immediately, but they die within a month, and some people up to a full year, depending on what happened with their pregnancy. Hemorrhaging is really common, but we don't know all the causes because the recording is not perfect on this. But this is another issue. If you remember, I talked about infant mortality early on and talked about how infant mortality is an example of a health disparity in the United States. The same is true for maternal mortality. So the definition is the death of a woman while pregnant or within a year of birth due to a pregnancy-related complication. The causes are hemorrhaging, severe bleeding, often while giving birth or right after, infection, high blood pressure, delivery complications, and so on. People can run into quite a bit of trouble sometimes. And then it also can be related to an unsafe abortion. That's very, very rare, but it can be a cause. So here's the maternal mortality rate. Again, is death per 100,000 births. So that gives us a rate and a number to think about. So here's a table that shows the maternal mortality rate. And I just picked out the United States for this. I used a brand new reference here, Centers for Disease Control and Prevention. I always look there to make sure that we're clear on the numbers. This is a report. If you're interested in looking at this report, it's in the notes section of these slides. So as you can see, in the United States, the overall, to the best of our understanding, to the best of our ability to collect data, which is always a little questionable, it was 15 per 100,000 births in the United States. In 2016, it went up a little higher. And then we start looking at a race and ethnicity breakdown. So the number is lower than the average for Hispanic individuals and white individuals. And again, much higher for Blacks and American Indian Alaskan Natives. So this is a clear example of a health disparity. And the same, if you watched the videos that I had prepared for you that talked about infant mortality, there was also information about maternal mortality there. What we do know about it, there's many things we don't know. What we do know is that most of the deaths are preventable, especially hemorrhaging. And there's this really excellent article out of California a few years ago, how they pretty much brought down the maternal mortality rate. Hospitals decided to prioritize that one thing. And what they did is y'all have seen medical movies, right? Like crash carts, right? You know, someone has a heart attack or something, and they get a crash cart out. Well, they created a crash cart for pregnancy. It had all the things that you needed in case somebody started hemorrhaging right there in the room instead of, you know, running off to get it somewhere. So it was like we save lives with a crash cart, but this was saving lives for women who may, because we don't always know who's going to be at risk during the delivery. So a lot of it is preventable. And so the causes is heart disease and embolism, you know, hypertensive, hemorrhage. So some of these things, lifestyle can prevent, but also good medical care can prevent. We also talked about last time how not everybody has even access to healthcare or feels comfortable getting healthcare that's personal for them, where they have their needs met. But it's the same story as before. So the risk is affected by age. So after age 30, the rate for Black women is 45 times that for white women. And education, and this was true with infant mortality as well. With a college degree, the rate for Black women is 5.2 times that for white women with a college degree. So education, for some reason, makes it worse, increases risk, and older age increases risk. Now, the Centers for Disease Control and Prevention has initiatives to help decrease these health disparities, decrease this risk for everyone, but it's just something, it's a call for action, and also a call for universal health care, so that regardless of the income of individuals, they have access to health care, because maternal care can make the world of difference. So prenatal care prior to birth. All right, the next topic, and this is very interesting. This will help you think a lot about development. There's a term called a critical period of development. And I have the definitions here on the slide. So body structures develop along a predictable timeline. I'll show you on the next slide what that means. But like the kidney's going to grow at a certain time, brain cells are going to, nervous system cells are going to reproduce at particular times, skeleton gets formed at particular times. So there's a critical period of development is when these structures are forming. And they follow a predictable timeline. And what happens is, if there's a disruption, and I'll give you examples of this, during a critical period of development, it can have permanent effects on the fetus. So let's continue this. This is the next slide. This shows the sensitive times during a baby's development. Those are the critical periods, and the risk for defects. So think about this, and we've talked about this before to some extent. Here's the period of the embryo up to 8 weeks, and then here's the fetus. Notice when organ systems and structures are developed. All right, so here, for example, the brain and spinal column, you remember neural tube defects where the spinal cord closes quickly within 3 weeks of conception, pretty much 3 to 4 weeks. And so these are critical periods. If there's an insult, such as not appropriate amounts of folic acid, that can have an effect here that is permanent. The actual development is dependent on having everything right at the right time. Okay, so another thing, here's when the heart develops, arms and legs, ears and eyes, and so forth. I don't know if you remember seeing the slide with excess vitamin A, but the ears were malformed. So what happened is the excess vitamin A interfered with the development of the structure of the ear. So that was something that causes a problem. So critical periods of development are important, and they make us realize that we need to be careful during the entire 9 months. So what disrupts these critical periods? You're going to be familiar with some of this. For example, physical agents. You may know some of this, but probably most of us has had an X-ray before. And when you're young, they typically have you wear a lead apron so that all the sex cells aren't impacted by the radiation, because radiation can cause DNA damage. Okay, so you may have had that experience. Well, you don't want to X-ray during pregnancy either, because it can cause fragmentation and DNA damage. Another problem is heat. Pregnancy is not a time for hot tubs, and ideally not a time to get fever. So keep that in mind. So chemical agents, drugs, I have things in red here that we're going to pull out in the next few slides. So chemical agents can also cause changes during critical periods of development. Alcohol can be a serious problem. Lead can be a problem. There are certain viruses and parasites that are causing problems. I will talk about these. The ones that are in red are the ones I'm going to pull out and focus on. So I have about a slide for each of those. Now, nutrition matters too. We're talking about lots of things here. This is lifestyle and also nutrition. So for nutrition, we already mentioned this example, insufficient or excess nutrients. Excess vitamin A can affect brain development and ear formation. Insufficient nutrients like folic acid can affect the closure of the spinal cord and neurological development. So also, besides particular nutrients, mom's physiology matters too. Okay, so mom's physiology, if she gains excess weight, she's already obese, has diabetes or hypertension, all of these things can affect the pregnancy. Okay, so here's the same slide again, and I told you I was going to pull out 5 of those items that affect the critical period of development. One of them is alcohol use. And this is to let you know what alcohol consumption patterns are like in the United States. This data is updated every couple of years. So about half of women drink alcohol in the United States. 10% of pregnant women drink alcohol. And 3.1 report binge drinking during pregnancy. Okay, so we know that alcohol is a teratogen. And so we're looking at brain, spinal cord, central nervous system development. And you can see the critical period extends all the way through here. Alcohol can affect neurology, but alcohol can also affect other structures such as the growth of kidneys and other development, lots of stages of development. So this gives you the background. So why do we care so much? Okay, why we care is because alcohol consumption is associated with what is called fetal alcohol spectrum disorder. This is a group of conditions. We used to just call it fetal alcohol syndrome. You may have heard that term before, but now we call it's a spectrum disorder because there's a variety of effects that can be affected. So the typical fetal alcohol syndrome, which is the strongest case, is associated with facial changes. You can see that the eyes, the lids here are different, small eye openings, the flat mid face, the nose is upturned, which a lot of kids have that. A smooth philtrum, there's typically, in most people, there's a little groove right here at the top of the lip. It's not that way in a kid that's got full-blown fetal alcohol syndrome. Thin upper lip, small chin, and the ears are abnormally shaped. So what happened is alcohol disrupted development during critical periods of development. And so the facial features, small head, smaller body, and then there's this central nervous system function problems, attention span, vision, hearing, learning, memory, all those kinds of things. So another part of the spectrum is alcohol-related neurodevelopmental disorder. In this case, think of the term to help you remember this. Neurodevelopmental has to do with functioning. So intellectual problems, behavioral problems, and impulse control problems. Okay, this is the behavior arm of them. A kid with a full fetal alcohol syndrome has everything. Some kids, you can tell at birth that they have fetal alcohol syndrome. But other kids are born and they may not have these facial changes, but they may have effects from alcohol exposure that don't show up until later. This is why it's difficult for people to know, I don't know, that want to drink, want it to be safe. Okay, so the other category is alcohol-related birth defects. This is when you do see physical changes. There can be defects in the heart, lungs, kidneys, and individuals can have hearing impairment. So these are the spectrum, right? And so a variety of things that can happen. Now, The issue is there's no safe amount or safe time to drink alcohol during pregnancy. I like, usually I have a class discussion at this point because all of us have been exposed to people that have had alcohol maybe during pregnancy. Is anybody feel like telling a story about that or talking about something that they've seen?
I've just heard like some pregnant women say that they've been advised that like one glass of wine wouldn't hurt and it sometimes would be like have a positive effect. I don't know much about it, but
Thank you for asking that. I read this carefully, and let me just be clear about, I have no horse in this race. If I thought alcohol was safe, I would tell you it was. I think women, we have enough on our plates in terms of managing pregnancy and lactation, all this kind of stuff. If something like alcohol were okay, because it would calm people down and if they enjoy drinking, I would say, you know what, it seems okay. And you can, if you did a PubMed search and looked at what the literature looks like, there are several studies that say, you know what, we didn't really find anything at this dose. However, there are studies that do show problems. And if we know that alcohol is a teratogen, we just don't know exactly if it's safe ever or how much, but we know it's a teratogen. We know it causes birth defects. That's the reason that you have to go cold turkey. Now, I know doctors say things like this. They don't have access to any more literature than I do. In fact, I'm sure I read a whole lot more about it than they do because that's what I do for a living, right? And so nutrition professionals and academics study this stuff, and I don't believe in this. And I have had difficult situations. I've been in family trips, not my kids because they would never drink during pregnancy because I'd kill them. But I have been with extended family members where people 6 months old went to Europe one time, 6 months old, 6 months pregnant. A extended family member was drinking wine because we were in Florence, and it's hard to go to Italy without drinking wine. And it's hard to witness people do it. They'll order alcohol in restaurants. They can maybe, her kid seems fine. He's hyperactive, but so were my kids. I didn't drink. So it's hard to know cause and effect, but we know there are cause and effect relationships. It's just hard to pin them down. Does that make sense?
yeah, so pretty much it's just too much of a risk to even think about taking really.
Yeah, and it's such a short period of time. When you think about it, we tend to, we tend to go off on our freedoms a lot in this country, and I'm not going to start on that stuff, but we tend to think, well, I should be able to do everything I want to. And you can. It is not illegal to drink during pregnancy, but you're taking a risk with the entire life of another person. And that's the issue there. And it's only 9 months. Right. So the other issue is that obviously, I mentioned earlier, about 50% of pregnancies are unplanned. You know why people get pregnant sometimes is because they're drinking, okay? And so they're not paying attention to birth control. And so then if they're not paying attention to birth control, not paying attention to their menstrual cycle, then they can get pregnant and if they're involved in heavy drinking, then there can be a few weeks of heavy drinking before she understands what's going on. Now, I will say there seems to be a grace period. Don't quote me on this. This is what I think. I don't have a PubMed citation on it, but I do have some, but there seems to be a grace period that before implantation occurs, y'all remember it around day 8 after conception is when then the zygote starts digging into the uterine wall, right? There seems to be a grace period from when fertilization happens to when implantation in the uterus starts. So if someone is drinking and then they go, oh, they're paying attention and they realize I could have become pregnant, they can pay attention and catch it and stop it before having any negative effects. That's my understanding. That's the best of my understanding of this. But I would say this is not the time to drink. And if drinking is that important, we all need a little life rearrangement on that. maybe rethink this whole family plan. Okay. The other thing is, once you have a kid, you can't drink because you don't get any sleep. she may have a drink. There's actually some safety, and I guess we talked about this with lactation, but there's some ability to have a drink every now and then, but you have to stay cogent enough to be safely take care of a kid and get up every 2 hours. So your party and time, your personal party is over for a while. The party that involves alcohol this is not that time. So I guess that would be the best way to put it. Just to give you a little feel for this, what happens to kids that have adults that are fetal alcohol syndrome kids? Well, one thing that I find very sad is they all know, as soon as they get old enough, they know that they've got a problem, right? So they understand that it was maternal drinking. And mental health problems are so common. Oftentimes people are institutionalized, they run into legal trouble. They often have trouble with appropriate sexual behaviors. They will in a work environment, they will sexually advance on people without understanding that you can't do that. And they have trouble getting past that behavior, and that's what gets them in trouble. Many can't live independently, they can't stay employed, and they continue to have alcohol and drug problems. So the prognosis is terrible.
We had
yeah.
They said they find it interesting how births are more sensitive now than at the beginning stages of human life. Why do you think that is?
Say that again.
So they find it interesting how birth seems more sensitive at the later stages than at the beginning stages. Why do you think that is?
Birth, you mean development?
Yes.
Okay, what it has to do with, if we go back and look at this is good enough. What's going on is this critical period of development is going on here, right? And so it's actually not true. What I said was before implantation occurs, this may be safe, right? Before implantation occurs. But once implantation occurs, from here throughout, a teratogen such as alcohol can have an effect on the entire body. So it is from the very beginning. It's just because, I think that if this is the question you're asking, before implantation occurs, there's not as much way for the alcohol in the bloodstream to get to the dividing cell. Does that make sense? So it's in the fallopian tube and it's still hanging out. There's not a lot of circulation there. So it's not in the bloodstream, right? So once it goes and then it gets plugged in, then it starts to get mom's alcohol from the placenta. Does that make sense?
Okay, so I drastically misunderstood the question.
Okay, cool.
He was asking about, like, in the sense of life, like 2020 versus 200 BC, like life seems more sensitive now than it did before. I think I understand it now.
Well, okay, let me see if I'm interpreting this way. I don't know if any of y'all watched Game of Thrones, but it was my religion for a few years. So the Game of Thrones people drink, like crazy, right? And so we look at history and you go, well, drinking was normal, okay? And there's others, I don't know if any of y'all watched The Outlander, which is a long series of people going back in time, right? And they drink all the time, right? Drink pregnant. It seems like a norm. And part of our reason that we think that's a norm is because of movies and history, things like that. But we still had fetal alcohol syndrome if people drank too much. We just didn't have the data on it. And then also, we have awful lot of alcohol in our lives right now. It's such a norm now, whereas the norm was, there's always been alcoholics, but now it's a norm where it just seems, I'm put upon if I can't drink during a particular time, that's my lifestyle. I think it's always been a problem. Access is crazy right now. Right. Of course, what happened when the entire place shuts down is you can still buy your drinks, right, from restaurants. That's the one thing that they allowed people to do even when we were closed for COVID.
We had one other comment.
Okay.
Someone said they also find it interesting how some people say small amount of drinking is okay, and yet everyone says smoking is among the worst things to do while pregnant. Why is that?
Because, and I thought I had smoking on here, but I had it earlier in prenatal. So here's the deal with smoking. What it does, the nicotine in it's a vasoconstriction and inflammatory compounds. It causes inflammation in the maternal body, but also it causes blood vessel restriction. And so actually, she smokes during pregnancy. Her blood vessels are smaller, The placenta is less efficient at carrying nutrients from her body to the fetus and from the fetus back to getting rid of the waste products. So the placenta is smaller, and that's more likely to result in the development of a small baby. That's why it's so bad. Does that work? All right. Cheerful topics, right? Some of this is hard. All right. I'm going to talk for a few more minutes, and then we'll break up into our groups. So lead, we've mentioned lead. I just want to bring it up again. Mom should not, during pregnancy or prior to pregnancy, should not be involved with lead. And this paints in older homes. Don't go and remodel your house and sand it down if it's got lead paint. Glazed pots, some old dishes. If you inherit old dishes from somebody in the family with a glaze on them, they could have lead. Construction and plumbing, depends on the oldness of the house. So there's ways to have exposure to lead. So the best thing she can do too is also have these calcium and iron, which interfere with lead absorption and help protection. But the outcome, if mom is exposed to lead and the kid then through her is exposed to lead, the outcome for both of them is bad. Mental impairment for him or her, and also physical deterioration for mom. So that's a bad one. Okay, the next one is toxoplasmosis. I usually ask for a show of hands how many have heard of this, and usually it's about a third of the class. So if you haven't, it's time you did. Toxoplasmosis is a condition caused by an intracellular parasite. We get it from cats. I mean, we get it from other ways, but typically it's because we have cats as pets. Humans have been highly exposed to cats and to Toxoplasma, and if that's, there's this organism is Toxoplasma gondii. And so our exposure, if we've been exposed, then it's probably not as big of a deal. But, and then how we get it, cat feces, and, unfortunately, if you have a cat in the house, you can't avoid that. So what does it do? During a rodent life, like a mouse, think of a cat catching a mouse, right? Think of an outdoor cat. When rodents get this parasite, they stop being afraid of cats. It affects with their brain. They stop being afraid of cats, and they're actually attracted to the smell of cat urine. And so they kind of go up and offer themselves as a sitting duck, and then cats eat them. Okay, so that parasite is actually controlling the mouse because it wants to get into a cat where it can grow up and make babies. This is called the definitive host of this particular parasite is a cat. So when cats have toxoplasma in them, what they do, they get the adult worms in there, okay, or the adult organisms in there, sorry. They get the adult organisms and they make babies. Okay, and so eggs will go out in the cat feces. So if mom is infected for the first time, not past here in the past, but if she's infected for the first time during pregnancy, this can be deadly serious. Even though this isn't a nutrition issue, I always bring it up here. So babies can have severe symptoms that show up later if mom is infected for the first time before birth. It may not show up right at birth, but they can have head size changes, bruise, anemia, nervous system issues. Whatever caused the rodents to be crazy can also affect the humans a little bit and affect their neurological function. So what do we do about this? Don't eat raw meat, which is one way to get it too. If you have a cat that's been an indoor cat, don't change the litter yourself, but if it's pretty much safe, if it's been indoors for a while, because when they don't, even if they've had it, they don't keep putting it in the feces. So when they poop, there's no toxoplasma in there. It only occurs like right after you get their first infection. So if you bought a new cat, they have got to be free, but if you got a new cat, okay, a new cat could have toxoplasma. And if you go pet an outdoor cat, it could have toxoplasma. And if you have a sandbox, there can easily be any cat in the woods that'll go out and poop in there and then put toxoplasma. So these are things you need to avoid.